All right, starting from the top. The first hormone in the pituitary, prolactin. And it's always under inhibition from dopamine from the hypothalamus. That means if you want to stimulate prolactin, you actually have to inhibit dopamine. Which means if you're asked how prolactin is released, when the baby stimulates the nipple, obviously sensory fibers release a neurotransmitter which will inhibit this, and that's how prolactin is released. So you have to desuppress prolactin. So stimulation of the nipple is the main stimulus for prolactin release. Where is it going to go? Mammary glands. No hormone is released, but its action is milk production. Milk production. And that's important that you look for production. Well, it means that if you do anything to inhibit these fibers, prolactin will go up. Everybody understand? If you do anything to inhibit these fibers, prolactin levels will rise. Everybody follow that? That means if I had any kind of pituitary tumor, it would cut off these fibers. Which is why all pituitary tumors will produce high prolactin levels. So they love to ask you what is to test. What blood test would you order if you suspect a pituitary tumor? It's always a prolactin. Because no matter what the tumor, it's a high prolactin level. But remember, under neoplasia, the most common pituitary tumor is non-functional adenoma. I didn't say it's prolactinoma. The tumor is not producing the prolactin. It's just cutting off the fibers, disinhibiting prolactin. So the most common blood test abnormality associated with pituitary tumors is a high prolactin level. High prolactin will stimulate the mammary gland, so you get galactorrhea, which is milk dripping from the nipple. Galactorrhea. And then high prolactin will also inhibit GnRH. So now you get amenorrhea. That's why they talk about the galactorrhea amenorrhea syndrome if you're suspecting pituitary tumor. So if a patient presents with galactorrhea and amenorrhea, you should think of a pituitary tumor. High prolactin levels. Well, I can inhibit that dopamine not just by a tumor, but I can do it with a drug. They're called dopamine blockers, which you already heard under psychoses. So the antipsychotics can all give you galactorrhea, amenorrhea as a side effect. So as a review, we had the phenothiazines, chlorpromazine, perchlorpromazine, perchlormethazine. We had the thioxanthines, thiothixine. We had the butyrophenones, haloperidol, droperidol. And then if you have too many extrapyramidal side effects, we have the atypicals. Risperidone, clozapine, Olanzapine. All right, Sherry, which one of these have the strongest D2 blocking activity? Jesus? The most potent D2 blockers are in which family? The butyrophenones are the most potent D2 blockers. Remember I said if the person is actively psychotic, that's the category you want to go to. You want to stop all those positive symptoms right away. But then that means they have the highest incidence of galactorrhea, amenorrhea as a side effect, as well as all the other things we talked about, the extrapyramidal side effects like neuroleptic malignant syndrome, dystonic reaction, akathisia, tardive dyskinesia. Which ones have strong anticholinergic side effects, Kayvon? The phenothiazines. So if you have a patient who's agitated, who hasn't slept in a while, then that's the one you want to use, because anticholinergic will put him to sleep. So potent psychoses, you go here. Agitation, you go here. What was the benefit of the thiazanthines, Erica? Right, non-compliant, long-acting for like homeless or migrant workers. You only have to give it once a month. Okay? Otherwise, they're just like the phenothiazines. Under the atypicals, Sherry, which one causes agranulocytosis and seizures? Which one? Clozapine. Right. You had a question, Jesus?
Yeah, on this
thiazanthines?
Did you say before that was IV or?
No, they're depot, IM. You just shoot into a big muscle. Okay? So all of them, same side effect profile, is just worse with these because they're potent, less with these because they're weak, more anticholinergic side effects, so more of the mid-races, dry mouth, constipation, impotence, urinary retention, you get with these. But they make you sleepy, so that's why we use them in agitated patients. Which one of these also blocks alpha receptors? Christine? Which one of the phenothiazines also blocks alpha receptors? Chlorpromazine. So it can cause orthostasis. You stand up, you pass out. Okay? So the antipsychotics can cause galactorrhea, amenorrhea.